quote on a website called quotesgram.com. It states, "If you don't wear the correct PPE, the joke's on you." Personal protective equipment is special equipment you wear to create a barrier between you and germs. This barrier reduces the chance of touching, being exposed to, and spreading germs. If you do not use the correct PPE in the medical field, whether you are working on or in an ambulance, hospital, nursing home, or anywhere that you're taking care of a patient, you're taking a chance of infection. Taking into consideration our current situation with the COVID-19 virus, it is a highly contagious and deadly virus. If you do not take the precaution of protecting yourself and anyone else who you come into contact with after that patient who has the virus, you're taking a deadly risk of getting the virus or being a carrier of it and giving it to someone else you come into contact with. And if you do come into contact with any unprotected exposure, for example, not wearing recommended PPE, should be reported to an occupational health service, a supervisor, or a designated infection control officer for evaluation. Close contact is defined as being within approximately 6 feet or 2 meters of a COVID-19 case, or secondary, the provider has a high risk of coming into contact with respiratory droplets. For example, if a healthcare worker not wearing PPE is coughed on during the suctioning of a patient or while giving a nebulizer treatment. I have a friend who is a paramedic. He is, for whatever reason, does not take this virus seriously and does not deem PPE, for example, masks, gloves, respirator, gown, hair cap, face shield, or shoe covers as a priority or something he should do. He is taking a huge risk in catching the virus. As it is, he has been exposed a few times picking up patients, but thankfully he has not gotten the illness. Nonetheless, he is still putting himself, his coworkers, and any healthcare professional he comes into contact with at the hospitals he transports to in danger of getting COVID. Personal protective equipment, PPE, helps prevent the spread of germs in the hospital. This can protect people and healthcare workers from infections. Even in general circumstances in the hospital, you come into contact with a patient that has any contact, airborne, or droplet precautions, for example, tuberculosis, influenza, pertussis, pneumonia, meningitis, SARS, MRSA, RSV, and many more attached to their charts. You may need to use different types of PPE for different people. Your workplace will have written instructions about when to wear PPE and what type to use. You need PPE when you care for people who are in isolation, as well as other patients. There's different types of PPE and they all have specific purposes. Wearing gloves protects your hands from germs and helps reduce the spread of germs. Masks cover your mouth and nose. Some mask has a see-through plastic part that covers your eyes, also known as a face shield. A surgical mask helps stop germs in your nose and mouth from spreading. It can also keep you from breathing in some germs. A special respiratory mask, N95 respirator, forms a tight seal around your nose and mouth. It may be needed that you do not breathe in small germs like tuberculosis bacteria, measles, or chickenpox virus. Eye protection includes face shields and goggles. These protect the mucous membranes in your eyes from blood and other bodily fluids. If these fluids make contact within your eyes, germs in the fluid can enter the body through the mucous membranes. Clothing includes gowns, aprons, head coverings, and shoe covers. These are often used during surgery to protect you and the patient. They are also used during surgery to protect you when you work with bodily fluids. Visitors wear gowns if they are visiting a person who is in isolation due to an illness that can be easily spread. You may need special PPE when handling some cancer drugs as well. This equipment is called cytotoxic PPE. You may need to wear a gown with long sleeves and elastic cuffs. This gown should keep liquids from touching your skin. You may also need to wear shoe covers, goggles, and special gloves even after you are done with the patient. Your PPE must be disposed properly. Remove and dispose of PPE safely to protect others from being exposed to germs. Before leaving your work area, remove all PPE and put it in the right place. This may include special laundry containers that can be reused after cleaning, special waste containers that are different from other waste containers, and specially marked bags for cytotoxic PPE. In conclusion, I'd like to thank you for listening to me, telling you how important PPE is and the proper ways to use it and when to wear it. That website was right. If you don't wear the correct PPE, the joke's on you. If you do not use or wear the correct PPE in the medical field, whether you are working on or in an ambulance, hospital, nursing home, or anywhere that you're taking care of a patient, you're taking a chance of infection, as well as a risk of giving the infection to someone who's at a higher risk of dying from it. If you're in the medical profession, your job is to keep yourself, but most importantly, your coworkers and your patients safe and help them, not to make them worse by not wearing the appropriate PPE. Before you walk into a patient's room, think about if that was a family member, and would you want them to get worse by their nurse or doctor not wearing the correct PPE?